Hi, my name is Dr. Sam Shay. I'm drsamshay.com or healthdetective.co.nz. And professionally, I'm a licensed chiropractor. I'm also an acupuncturist. I'm also a functional neurologist. And I'm very happy to say I'm also a certified Fitgenes practitioner. And the reason I got into genetic testing is that I've dealt with a lot of really, really complex patients, from severe fibromyalgia, chronic fatigue, bad digestive issues, all sorts of hormone imbalances, toxicities, and everything else. And what I found with the Fitgenes testing is that it put an entire different perspective that explained so much of why my patients got to where they were, more importantly, how they can get out of it, and even more importantly, stay out of it. What it did is that it answered the questions around the key drivers that led to all these chronic processes, but more importantly, it didn't just give answers, it organized the data. We had, I looked at other genetics companies, and there were, these companies, they have all these lots of SNPs and lots of variations, but it's not organized in a way that's useful to both me as the clinician and useful to my patients. So when I get this 58 gene panel, and it's organized by inflammation, anti-inflammation, free radical scavenging, liver detox, vitamin D receptors, methylation, blood pressure, cardiovascular health, fat metabolism, not only do I understand it, but my patients, believe it or not, understand it. So when they see the report, it's how do I describe this? It's like behavior can change like that. When I've never seen it with any test ever to this scale. When you show a patient a genetic test, the results, and it's an organized genetic test, and it's organized in a way by drivers, not by diseases. Like you're going to get this gene, you're going to get this disease. It's not organized like that. It's an empowering test, and patients see that. They will change their behavior. And what the proof is that I now have more men coming into my practice wanting to get their genes tested. Before, you had to pull men by the teeth, usually be dragged by their wives kicking and screaming to go into any health clinician setting, get any test. But with the gene test, they actually want to come in and get tested. So to me, it's opened up a whole new sector of population who would otherwise never be interested in getting their health checked, i.e. men. It's answered a lot of questions in terms of the underlying causes for all these chronic disease processes, inflammation, free radical toxicity, everything else I mentioned. And what's even better is that the lifestyle recommendations are organized in the back-end software, obviously filtered through my clinical eye and working with each patient individually. But what you can see, because the genes are organized, then you can see what lifestyle interventions come up again and again and again under the category of the specific driver that needs help. So you can actually drill down into fewer lifestyle interventions, fewer supplements, fewer dietary changes that have the biggest impact with the least amount of changes. You get the least variety of changes, so you actually make it so much simpler for your patients. And the other thing is that my patients now know for life what they have to do in terms of their lifestyle, their diets, their supplements. They're not going to go off and get lost in the morass of a radio show, a magazine article, and all the rest of it. I'm going to buy this supplement, that supplement. No, they now know based on their genes what they need for life and lifestyle and so forth. So I'm so grateful to be a Fitgenes practitioner because it's answered so many questions for me. My patient compliance is up. They're happier. They know what to do for life. They're willing to do it. It's just transformed my practice. And I very much look forward to continuing my journey with genes, because it's also, as a clinician, the genetic stuff is so interesting because it's so deep. I will never get bored looking at genetics, and I look forward to a very long future working with Fitgenes.